Hi, I'm Reena, and today I'm here to tell you about World Autism Day. World Autism Day is observed on 2nd of April every year. This day recognizes and spreads awareness for the rights of people with autism and to help them lead a happy and a healthy life. Through this term autism. Autism is a developmental disability caused by differences in the brain involving persistent challenges with social communication, restricted interest, and repetitive behavior.
Hi, my name is Suvarna Karande and I'm going to talk about signs and symptoms of those on autism spectrum disorder and why is it exactly called a spectrum disorder. So first let's take a look at some signs which are visible at a very young age in children who might be on spectrum. One very important sign is lack of eye contact when the child is talking to the adult or to the caregiver. You will notice that not only sometimes young children, but even older persons who are on spectrum will look down or look at the wall or look at an inanimate object instead of maintaining an eye contact and continue talking to the person. The next important sign is at a young age especially, the child doesn't respond when the parents or any other caregivers call their name. They may respond to any sudden noise, to the noise of a bell or that of a TV, but will not respond to their names. Third very important sign is lack of speech or delay in speech. Almost 1/3 of the children who are on spectrum tend to be non-verbal. That is, they may not really speak. And others also tried, and many times it is observed that they try to use speech and language less and try to communicate through gestures many times. So speech and language development delay is another very important sign of those on autism spectrum disorder. Next is they have a huge difficulty in adapting to new situations. Many children or even adults on spectrum prefer a set routine, and if that routine is disturbed for some reason, then they feel a lot of distress and react in a very different way. So children can throw a tantrum and adults can feel a lot of distress. In young children, a lack of play skills is observed. It is observed that there is rest pretend play, and play is also in a very pattern-based manner, like arranging objects or arranging blocks in a particular manner, or spinning objects, spinning wheels. So a very limited play is observed, and if you try to remove any of these blocks, then the child will probably show a lot of distress.
After screening the early signs and symptoms of autism, mental health professionals use psychological assessments to diagnose and to measure the severity levels of autism spectrum disorder. Psychological assessments are objective, which does not include any personal opinion or suggestions or any personal bias. So basically, these assessments are authentic and standardized in nature. Psychological assessments are important to administer because it gives us diagnosis, it gives us a clear idea about the severity levels, and based on the test results, we can make a treatment plan for the child. Intellectual disability frequently co-occurs with autism spectrum disorder. Therefore, we also use standardized IQ assessments to measure the intellectual disability of the child.
There are many treatments that can help children with autism to acquire new skills and overcome a variety of developmental challenges. They help improve your child's ability to socialize and play, function academically, and move through everyday life with adaptive skills. There are variety of therapies and approaches in terms of treating with child with autism. Some autistic therapies focus on reducing problematic behavior and building communication skills and social skills, whereas others focus in sensory integration, motor skills, emotional issues, and food sensitivity. One of the intervention is behavioral therapy, which is commonly used for autism spectrum disorder treatment that aim to encourage desirable behavior and reduce unwanted behavior. In ABA treatment, which is applied behavioral analysis in which they attempt to reward the desirable behavior and discourage the unwanted behavior. For example, a therapist might offer praise when a child tries to politely ask for help, and whereas avoid when the child is being aggressive and outburst. The other modality could be speech and language therapy, in which we help the child to understand and comprehend speech in social setting, understand verbal and non-verbal cues, how to protect themselves in social situation. Also, skills is broken into parts and also into letters, and in a way that even a stroke is being understood to understand the language in depth. Apart from this, occupational therapy is also encouraged in terms where they learn to be more independent and participate in a wide range of activities in terms of grooming themselves, handling themselves in terms of their social situation. But as it is a spectrum of disorder, the approach is to help them be more independent in the social situation, and hence it is a tailorized program in terms of your child's needs and specification, as every child of autism is not the same, and the severity and the functioning of the child is different, and hence there is a tailorized program for every individual child.
As soon as parents come to know that the child has autism, the first question that comes to their mind is, will my child be normal again like any other child? Or teachers, parents often ask us, is it possible to integrate children, adolescents, young adults with autism in our society? So we have just seen that it's just that the needs and requirements of these individuals are different. They just need a place, task, work that is suited to their needs and requirements. So here integration does not necessarily mean or may not necessarily depend on whether a child goes to a regular school or a special school, or whether the individual is able to secure a regular 9-to-5 job in a company. And that is one kind of integration. But integration for autistic children would mean that if they are able to learn something new every day, or they are able to learn and explore something through art therapy, dance therapy, occupational therapy, sensory integrated therapy, and then that is integration for them. And while learning and exploring in these areas, if the child is happy from within, if the child is at ease in that environment, if the child is comfortable while doing so, then that would be integration for these children. If they are able to take care of themselves, even in a small way, or if they are able to pursue what they can do, then that would be integration for them. Because they are very much a part of our society and they are doing their little bit here. We just have to see that they are not living in isolation because of autism. Autistic children will grow and become adults who will need access to sports, recreation, arts, employment, housing, social programs, and other such services. Not being included would lead to isolation, loneliness in them. We just have to give them the opportunities to help them use their skills and strengths that they have and not what we want them to have. If we can see that children with autism, if they are given a lot of training in some vocational areas, then they can do many things. Like many of the children or adults on spectrum are very strong visual thinkers, or many of them are very keen observers and can spot minute details which we can't spot. So they can excel in intricate work, or many of them have this ability to approach any situation very logically. So they are very good when it comes to taking objective decisions. Or many a times we see that individuals with autism, they work very well with animals because they can develop strong bond with animals because they can relate to the aversion of loud noises, overstimulation, eye contact. So they can be specially attuned to the needs of animals. So given right kind of atmosphere for them and right kind of surrounding, they can do many things here. So basically autism is like a rainbow. It has a bright side and a dark side. But every shade, every side is beautiful and important. So on World Autism Awareness Day, let's speak out against discrimination and let's celebrate the diversity of our global community and strengthen our commitment towards inclusion for people with autism. Thank you.